and today I'm speaking with Dr Michael Gillman about men's health. Michael, how do you treat erectile dysfunction?
I think you need to remember that erectile dysfunction usually means that the man has a blood vessel problem, and we need to get right to the bottom of that and work out what's going on. There's lots of different treatments available, but the main thing is to work out why is it happening for that man and diagnose what's happening.
How do you go about investigating your patients, Michael?
Well, firstly what I do is talk to them, ask them about how long this has been going on for. There may be some blood tests to do. We'll examine the patients very carefully. But the reason I'm doing all this is to work out the actual cause of the erection problem, because there's many different causes.
So, Michael, you're going to address their vascular risk factors. What are they?
Well, the first one is high blood pressure. The next one is high cholesterol, high sugar levels, smoking. If they're fat around the stomach, we try and get them to lose weight. But once I've done all of those things, then we actually come in with some treatment. Now, the first treatment we try is with tablets, and we now have Viagra, we have Levitra, we have Cialis, and we try these different tablets and see which is best for the patient.
I know many women are worried about their husbands taking these tablets. Are they safe?
Generally, yes, they are. There are some groups of men who should not take the tablets, and these are the people on nitrate therapy. Often men who have angina will take tablets under the tongue or wear a patch or take a tablet for angina. Now, these men shouldn't take it. The second group are those who aren't actually fit to have sex, and it's not just from the tablets, but they shouldn't use any type of treatment until they've actually had all that worked out by their doctor. Then we have other things such as injection therapy. Often men are concerned that it's a large needle, etc., but we use a diabetic syringe and it's actually quite painless if it's done the correct way. We have other things which aren't used as commonly, but things such as vacuum devices, and then of course there's a definitive treatment if none of these other things are working, or if the patient's after a permanent solution, and that would be the implant surgery by one of the urologists.
I've got a patient in my practice whose husband wants to start penile injection therapy. She's concerned about possible side effects.
Yeah, look, I think that the injections are very safe and they're very effective, and in fact they work out cheaper than the tablets. So while some men may be a bit reluctant to do it, or the partners, it's actually a very good treatment.
Michael, what should this couple look out for?
Well, there's a couple of things. One is a prolonged erection, what we call a priapism, if an incorrect dose is given. Repeated uses can cause scarring inside the penile tissues, and some people will get infection and bruising, etc. And some men just get sick of injecting.
Michael, I have a lady in my practice who doesn't really like her husband injecting. She finds it somewhat unromantic, lacks spontaneity.
Yeah, look, I agree. I have a lot of men also who don't like injecting. Their partners don't like them injecting. They find it insensitive and unromantic. But fortunately, there is a more permanent solution available.
Michael, what is this permanent solution?
Well, it's penile prosthetic surgery. The advantage in this, it offers spontaneity, so therefore there's no performance anxiety, and it works 100% of the time.
So, Michael, what's involved in having this penile prosthetic surgery?
Well, they get a small incision just in the scrotum, they're in hospital overnight, and that's it.
Well, when can they resume sexual relations?
Well, normally we wait about 6 weeks for everything to settle down, but then they can have spontaneous sex whenever they wish, and the device is actually quite robust enough. It lasts at least 15 years.
Michael, women cherish intimacy. How important is intimacy and lovemaking to the older man?
Oh, look, I think it's critically important, not just for the man, but also for his partner. And I think that it's also important to their quality of life.
In conclusion, Michael, what should we be telling our men with erectile dysfunction?
Well, I think we need to tell them that it's common. It may be a sign of blood vessel disease, which needs to be sorted out, and there's some very good treatments available now.